It's 2026. This is Dr. Donna G MD, your gynae guru, and Happy New Year. Periods, pregnancy, and perimenopause. For 40 years, that's the drumbeat of women's lives. And even after 30 years of practice, I'm still amazed that the majority of women don't understand what's happening with their bodies. I'm Dr. Donna G MD, and this is your Gynae Guru Show, where I discuss periods, pregnancy, perimenopause, and all the things in between. I'll share with you what we mean when we say things are normal and when things aren't normal. Let's talk about how you can help yourself and why sometimes, maybe many times, you need to call your doctor to get things right. Welcome to your Gynae Guru Show, where you'll get real talk for real issues. Hi, we are back. It is 2026, a brand new year, and there are so many things that we can talk about. So let's talk about how we're going to change the format of the show just a tiny bit and really be able to focus and drill down into what we can get done, what we can achieve, and what we can improve upon this year. So when we talk about the beginning of the year, people do their vision boards. They talk about resolutions. One of the new things is a bingo card. Another thing is to have your words for the year. And when it comes to my personal self, I have my words for the year. But when it comes to what we're going to do on the Your Gynae Guru Show, this year, I want us to pledge to not be afraid, to not be fooled, and to not be distracted when it comes to our health, especially women's health. There is so much out there, and I don't want you to live in fear. I don't want you to live uninformed, and I don't want you to live angry. There are a million things out there. Sometimes the information out there isn't intended to be a negative for you. It's there for the reasons that people post them. One of the things I think about is that people mean well. A lot of women, a lot of people are online. They're on TikTok, they're on Instagram, they're on Facebook, they're on YouTube, explaining to you what's wrong with healthcare, what's wrong with periods, explaining to you that you've got PCOS, explaining to you that you have thyroid disease, explaining to you that you're premenopausal or early menopausal, on and on and on and on. I can give you so many examples of what's going on there. And I'm not going to tell you that people are wrong or right. I'm going to have you understand that many people who get on the internet to talk about these issues are telling you their personal experiences. Their personal experience of one, a bad experience with the healthcare system, an inadequate experience, or even a great experience outside of the healthcare system, and they're sharing that with you. But there are so many times where people go so far as to insist that that's how everything should be, how everybody should act. That's the experience that everyone will get, and that's simply not the truth. So it's wonderful to hear individual stories, but you need to know the difference between somebody sharing their personal private experience, their personal limited experience, their personal opinion, versus the reality of some of the things that are going on. One of the examples I would give you is that, back in the day, and back in the day is like right before the pandemic kind of thing, but actually back in the day, in this case was Clubhouse in 2021, there was a pelvic floor expert that was really doing well. She had wonderful things to say, but she was very, very, very much against surgery for pelvic prolapse, that all you had to do is physical therapy and exercise and you can fix all of those problems. And the reality is that is not the truth. That may be that person's experience. That may be what that person wants for everyone. But the reality is that not everyone can fix pelvic floor dysfunction with simple exercise or simple physical therapy. Sometimes surgery is required. And trying to get that message out is difficult when people spend the extra time to make sure you believe that they're more the expert because of their limited experiences than some physicians and some true experts who have thousands of people's experiences to discuss. And I want you to keep that in mind. I don't believe that everything the physician says is correct. I don't believe that everything a non-physician says is wrong. I want you to start thinking about how you are going to make the decisions that you make for your health based on the information that you're seeing on the internet. That's all. And I want to give you some tools to help you understand how to figure out what is good information, what is a shared experience, and what really isn't good, healthy, factual, safe information. We'll talk about what kind of questions to ask in certain circumstances. I think that throws a lot of people off. You don't know what to believe. So what kind of questions do you ask before you decide who you're going to believe? And one of the questions to ask is, how much experience does that person have? What educational background does that person have regarding this issue? What level of clinical experience does that person have? And what are the bad outcomes, the negative outcomes, the unsuccessful outcomes that that person has experienced or has seen? You know, what's their success rate versus what's the rate of not being successful doing it the way that they do it? Do they have alternatives if their version doesn't work? Those are the kind of questions that you ask. And I want you to be clear, we're going to cover that. We're going to cover periods and pregnancy quite a bit, because there is definitely a need to start talking about what's happening in women's health. What, on an individual basis, do you need to know about how periods go? And then what kind of problems are going on? We'll talk about fibroids. We'll talk about PCOS. We'll talk about painful periods. We'll talk about pelvic prolapse. We will definitely talk about pregnancy. Let me just say that it is becoming increasingly worrisome how many women are so afraid, based on what they're seeing and hearing online about childbirth, that they're seriously starting to think about home births, thinking about having non-physicians in their birthing, process outside of a hospital, and even thinking about this whole free birth, that I don't need any intervention, I'm just going to do it on my own. I can't tell you how that creates a pit in my stomach. As an OBGYN, having a woman die in childbirth is almost unspeakable. And if you could see what I've seen, you wouldn't be so quick to believe the people who tell you how wonderful and safe it is to have a baby at home, how wonderful and safe it is to have a baby with no intervention. Having a baby is wonderful. A natural, spontaneous vaginal delivery, especially in a woman that's already had 2 or 3 vaginal deliveries, is just a beautiful thing. And yet a maternal death, a fetal death, an infant death, a neonatal death is almost unspeakable. And so we need to get serious about the consequences of the choices that we make. So we're going to talk about pregnancy. We're going to do a good bit of talking about pregnancy and our choices and what we believe and not believe. And I just want to start the year by giving you a few numbers. The U.S. maternal mortality rate is 23 maternal deaths for every 100,000 live births. That's how maternal mortality rate is written. And in the U.S., we have about 4 million births a year. So if you multiply 23 by 40, then you get 820 deaths. I'm sorry, you get 720 deaths. 720 women died in the U.S. In 2023 from complications of pregnancy. To put that in perspective, Nigeria had 993 deaths, maternal deaths per 100,000 live births. Nigeria had about 7 million births in 2023. And if you multiply that 993 by 70, then you're going to get 69,610 deaths. I want you to think about that. 69,610 women died from pregnancy-related complications in Nigeria. Now, the rate is 993, so let's put that in perspective. Puerto Rico had a maternal mortality rate of 11 out of 100,000 live births. Barbados, 35. Trinidad, 54. Jamaica, 130. Cuba, 35. The Bahamas, 76. Canada, 12. Ghana, 234. Mexico, 42. Senegal, 237. Brazil, 67. Australia, 2. Russia, 9. France, 7. Germany, Sweden, South Korea, Denmark, Belgium, the Netherlands, Qatar, and Ireland, 4. Spain and Japan, 3. That breaks my heart. We need to be in that group where we're seeing 1 or 2 or 3 or 4 deaths per 100,000 live births only across the board in the U.S. And we can do that, but we've got to get to work. One of the aspects of that is talking about nutrition, being healthier. What are we eating? How are we living our lives? What are we taking for supplements? What are we not taking for supplements? What other substances are we willingly putting in our bodies? What substances are going in our bodies that we don't even know is happening? We're going to talk about the effect of all of those things. We're going to talk about hormones. We're going to talk about vitamins and supplements. We're going to talk about so many things. I want you to be in a position where you can do for yourself and you can feel confident in making the choices that you're going to make to do for yourself, to be happy, to be healthy, for wellness, and more importantly, those choices and those decisions that you're making that are going to have a positive impact on your family, on your children, if you're caregiving, on your parents, on your spouse. Those make all the difference in the world. If you're responsible in a community level, on your community. The things that we can do with empowerment, with the knowledge that this is going to work, are incredible. And I want you to consider that. We're going to do wonderful things this year on the Your Gynae Guru Show. And it's designed to help you do wonderful things for yourself and wonderful things in your life. One of the other things to look at is giving you realistic expectations of how things are going, how things should be going, how to make adjustments for what's happening. You know, it's almost like the U.S. is falling apart. I mean, and I say that as if it's not falling apart, because it is. There's so much of that falling apart that has been willful, that has been because of the same hatred that's always been here. And yet, we have to thrive. We have to survive. We have to function. And we need to do that without fear. We need to do that without hesitation. And if you're worried about putting food on the table, if you're worried about your personal safety, if you're worried about your children's personal safety, and you can't get past that worry, then that's a problem. So we need to talk about, how do we handle stress? What are we going to do to get our spirits out of this cycle of fear and anxiety and helplessness? It's so important that we be in the best position we can be to make good decisions. You're tuned in to the Your Gynae Guru Show with Dr. Donna G MD. Let's take a break. We'll be back shortly. I thank you so much for joining me in this radio venture, because I want you to have information. I also want to hear from you. And one of the easiest ways to hear from you is if you go to my Instagram account, Dr. Donna G MD, DrDonna GMD. Follow me there and feel free to DM me with information about what you'd like to hear on this radio show. I need to get feedback from you. Let me know what you appreciate hearing about. You can even let me know what you disagreed with. I just want to hear from you. Okay, welcome back. I'm Dr. Donna G MD, and you're tuned into the Your Gynae Guru Show, and we're going to talk about that. One of the things I want to give you is always try to back up some of the things that I'm saying with numbers whenever possible. It's not to make you fearful. It's to put things in perspective. It's to let you know what point of view, what frame of reference are we coming from when we talk about X, Y, and Z. I can't tell you enough how knowing the numbers makes everything really seem approachable, seem understandable, seem doable. And that's why I try to give you numbers. We can talk about maternal mortality and how scary it is, because it's really scary. The U.S. maternal mortality rate is really ridiculous. We can talk about PCOS. Yes, there's a lot of PCOS, but I don't think there's as much PCOS as some of the marketing that you're seeing on the internet suggests there is. There's not so much dementia or risk of dementia being the thing that kills you compared to what you see on the internet. I'm going to swing back around to the things that make you afraid. Marketing very dramatically is designed to make you want to buy things. And if I have a specific product as a business, there are two ways for me to want you to buy things. I either generate enough popularity with that product that you must have it, or I need to scare you into believing that without it, harm will come to you. That's fear. And let's be honest, making you want it because you don't want to be left out, that's fear of being left out. That's fear of missing out. Okay? So fear is a foundation of marketing, because fear makes you act. There are plenty of things in the world to be fearful of. There are plenty of problems that we want you to get solved when it comes to health. But there are also plenty of folks out there who are willing to exploit you, who are willing to ramp up that fear just to get you to buy their product. And their product may not even be any good. Their product may or may not have the active ingredient that they're telling you to buy. Their product may or may not work for the majority of people, but that's not what they're required to do. They are simply required not to promise you that things will cure your disease. They cannot tell you things that are not true about the product and what it can do, and they're not allowed to have a product that doesn't have the ingredients in it. Really, you're out there on your own when it comes to what you're buying. And yet there are resources that do test products, that do look at ingredients and results and report what they find. And I want to share those resources with you. There is so much going on. There are so many things to be afraid of. There are so many opportunities to be taken advantage of. And yet, we're going to spend this year shoring you up, propping you up, filling you with knowledge, giving you tools to ask questions, to make decisions, and to feel confident in what you're doing. That's what 2026 is going to be about. We're going to talk about how you're going to handle stress. We're going to talk about how you're going to improve your exercise and activity levels. We're going to talk about how you're going to make selections of the foods that you eat and the supplements that you use so that you're enhancing your health and not taking away from it. We're going to do all of those things. We'll even throw some gardening type of things in there in terms of what you can grow easily on your own to help supplement what's happening in your diet and in the diet of your families. Let's talk about solutions. Let's educate you. And let me promise that you're going to feel better about yourself and women's health and your periods and pregnancy when it's all said and done at the end of this year. We're going to do a couple of live opportunities throughout the year so that you get a chance to ask questions. You get a chance to tell me what you'd like to hear very specifically, so that you get a chance to give me feedback about what you want to see on this show. I am looking forward to 2026, where all of us can go through life and we're going to say that you're not going to be afraid. I'm not afraid. I'm not fooled. And I'm not distracted when it comes to my health and the health of my family. I'm looking forward to this year, ladies. I hope you participate with me. I'll see you next week on the Your Gynae Guru Show. Thank you for your support. And that's it. We're done. Just for today. This is the Your Gynae Guru Show with Dr. Donna G MD, where I talk about periods, pregnancy, perimenopause, and all the things in between. For more information, for more details on some of these subjects, and for extended replays, follow me on social media at Dr. Donna G MD, DRDONNA GMD. Extended replays of this show will be available on my YouTube channels on Wednesdays after their first run. Go to Dr. Donna G MD on YouTube. Have a great day.